Welcome back to HealthTech Explorers. Today, we're doing something a bit different. I ran the exact same medical prompt through three AI tools, ChatGPT, Perplexity, and OpenEvidence. And yes, I used only the free versions of all three platforms. Why? Because more and more clinicians, students, and researchers are turning to AI for quick answers, but the quality, clarity, and clinical reliability of these tools can vary a lot. So in this video, we'll compare how each one handles a real-world patient scenario, from differential diagnoses and guideline-based recommendations to patient-friendly explanations. The goal is simple: help you see the strengths and limitations of each tool, so you know when and how to use them in practice or learning. The prompt that I used: a 57-year-old male presents to your clinic. He has a 15-year history of type 2 diabetes, recent HbA1c 8.2%, takes metformin and glympyride, and reports chronic fatigue, recent occasional dizziness, mild swelling in both legs, and trouble sleeping. No chest pain, shortness of breath, or fever. On exam, blood pressure 142/88, mild lower limb edema, BMI 32. You are a physician. What are the possible differential diagnoses? Are there any drug interactions or risks to consider? What initial lab tests or assessments would you recommend? Please include the latest clinical guidelines and cite relevant sources. Give a brief, patient-friendly explanation of what might be happening and why these tests are important. These are the answers from different AI chats. First, I asked ChatGPT. The answer you can find on a screen. You can pause the video and read the text. ChatGPT gave the most structured and clinically coherent response. It explained the reasoning behind possible diagnoses, covered drug interactions, suggested appropriate labs, and even provided a patient-friendly explanation. Next was Perplexity AI. Here is the answer from it. Feel free to pause the video to read it. Perplexity stood out for its real-time web citations and external references, but the clinical reasoning felt more like a list than a narrative. And the last one was OpenEvidence. Here's the answer from this chat. Again, you can pause and read the details. OpenEvidence delivered the most guideline-heavy, reference-backed answers, ideal if you need something formal and compliance. Ready, though sometimes it felt less conversational. Based on this side-by-side comparison, here are the key takeaways. ChatGPT shines when you want clear clinical reasoning and a patient-ready explanation, but doesn't natively provide citations. Perplexity is great for quickly pulling the latest studies and sources, but you need to verify the quality yourself. OpenEvidence is your go-to for rigorous, guideline-backed recommendations, though it may feel more formal and less conversational. What I really appreciate is that all three platforms gave me sources or references. This means I can actually click through, read, and double-check the information myself. A big plus for anyone who values transparency and learning. No single tool does it all. The most practical approach might be to combine their strengths. Use Perplexity for up-to-date references, ChatGPT for clinical reasoning and teaching, OpenEvidence for evidence-based rigor and compliance needs. In conclusion, AI tools are already transforming medical education and decision support, but they work best with human oversight. As these platforms evolve, learning how to integrate them smartly will give clinicians and students a real edge.